there's so much planning and there's so many important aspects that go into a veneer besides just the doctor's touch and what we see and how we plan things. It also has to go with communicating with a lab that you know and trust is going to deliver those results, you know? And that's why we're extremely selective. There's only one lab that I use for any veneers that we do, and that's because I know what results I'm going to get from them. I know that when I communicate this to them, they already understand what we're expecting. They already look at the faces the same exact way that I do. Yes, it does cost a little bit more, well actually significantly more to utilize that lab, but to us it's worth it because this is kind of, not only is it a life-changing thing, but it's like I also know that these patients are putting their trust in me to deliver the best result. There's definitely an art behind how you're doing it, which is also why even with the lab work, you have to make sure you're using an exceptional lab. All the veneers that we do are actually hand painted, and that's what gives it that natural appearance and that natural look, which is so important when it comes to veneers. You know, you don't want patients walking around being like, oh yeah, she got her smile done. It's like, no, you know, you want people walking around, and I think Geraldina will attest to this, people just comment on how beautiful your smile is. It doesn't look unnatural, it just looks like it's your smile, but kind of enhanced in a way. So I always say successful veneers are 10 years, you know, with the way that we bond them on, and if people take good care of them, it can last significantly longer than that. It's just a matter of like anything else in your mouth or anything else, you know, over time, they start to break down like your regular teeth do, but they're not gonna like break or fall off. You know, I've never had really a veneer fall off. With the way that we bond them on and the materials that we use now, you don't have to be concerned about that. But, you know, yeah, don't go, you know, bite on, you know, don't try to win beer bottles with your veneers because yeah, you probably chip them just like you will your natural teeth though. Veneers can be a costly option. You know, at the end of the day, it is a lot of work and there's a lot of lab costs involved. So we absolutely understand that there are higher costs associated with them. You know, we try to price ourselves, you know, we're not the highest and we're not the lowest, but we do an exceptional level of quality. That's the most important thing. Getting the highest level of quality for, you know, what can be an affordable price. We do have payment options, third-party financing to really break down the payments so that patients can make these dreams become a reality for them. And so the best part about veneers and delivery is not necessarily the day you deliver, it's actually, you know, 2 weeks later, 2 months later, when the patient gets used to it and they're smiling in all their photos, they come in the office, they got a huge smile before they even walk in. That's definitely the best part of it and the most rewarding part, I would say.